Welcome back. It's Wellness Wednesday, and today we are talking about adult attention deficit hyperactivity disorder, or commonly known as ADHD. Our mental health expert, Mary Jo Horton, is back. She's the manager of behavioral health at Memorial Health. Welcome back, Mary Jo.
Thank you.
All right, so let's dive in. Before we get to diagnosis and treatment, you say that if you have ADHD, you have had it since you were a child.
Yes.
And the symptoms can be easily confused with other things like anxiety.
Absolutely. Let's keep in mind that ADHD is the way that the brain is wired to take in information, process it, and that may not have been treated as a child, but that was certainly present.
Yeah, and so you say don't confuse it with anxiety or some other things like even trauma responses. I thought that was interesting.
So let's think about how they overlap. So if I'm anxious, I might not be able to maintain myself in an activity. I might be all over the place. My thoughts might be scattered.
Seems like ADHD.
Seems like ADHD.
Yeah.
If I've had a trauma response, something might easily startle me. I might be on high alert. I might not be able to focus. Seems like ADHD.
Yeah.
Even lots of things attached to procrastination. People confuse procrastination and what's attached to that to ADHD.
All right, so the way to figure it out, the difference is a diagnosis.
Yes.
You say that first starts with figuring out for yourself if you have symptoms of ADHD.
So you really want to learn how to be a good detective of yourself and really be honest with yourself. Is it that my brain is wired and I've always had difficulty taking in information in one way? Or am I really having these sensations of anxiety? Really being able to hone in so that when you're talking to a doctor or a therapist or whomever, you're giving good information.
And you say talk to a therapist to go through the symptoms and solutions. A psychiatrist, though, for an actual diagnosis and possibly medication.
Correct. You know, the doctor is a doctor, right? And so they're looking at whether or not this meets criteria for disorder and whether or not there's medications attached to that.
A therapist helps solutions, right?
So this is what I want to remind people.
Yeah.
A therapist is going to help you build on your strengths, because if you had adult ADHD, you've learned some ways to cope.
Yeah.
They're going to be very individual and specific to you. And they're going to use a variety of modalities to help you figure out how to work through your symptoms to function.
Okay, and because it's not always about medication, which we're going to talk about in just a sec, but I remember being a child, you know, half my class was on Ritalin at the time. Yeah.
Yes, and you know, it's really unfortunate because while medication is helpful, I'm not in any way discrediting that, we don't then have the opportunity to teach children and ourselves how to become emotionally present, how to deal with distractions, and how to do behavioral activation for change.
All right, so let's talk about treatment now. You say that strength-based perspective to navigate these symptoms. What does that mean?
Everybody who is dealing with symptoms, I guarantee you are doing some things right. Particularly if you had it as a child and you're an adult, you have found a myriad of ways to navigate. So let's build on that. What are you doing that's working? Then let's talk about times and situations where you start to have challenges, right? And so we want to look for solutions. We want to figure out how best to navigate. We don't want to be problem thinkers.
And mindfulness is key to that, some behavioral solutions. CBT, what is that?
Yes, so that's cognitive behavioral therapy. It's my favorite. And basically what it helps somebody do is understand how their thoughts, their feelings, and their behaviors are connected.
Okay.
So if I'm feeling a little bit this way, I behave this way, and it helps you shape and change that.
Okay, all right. So I love what you said about, because this is something I've thought about, actually going to get a diagnosis myself. You go to a psychiatrist and a therapist, really. Yeah, you two-pronged approach on
Absolutely.
that.
You really want somebody that's going to help you, teach you things, and then the doctor for medication.
And on the medication, I said Ritalin because that's what I knew from childhood. Is it Adderall as well?
So there's Adderall, there's Vyvanse. They're essentially all stimulants.
Okay.
So they're stimulating the brain. I do want to have people be thoughtful when taking a stimulant. It can be easily used for things that are not great, and then we get a little bit too attached to it.
Okay, all right. Mary Jo, always good to talk with you. Thank you so much for talking about this issue. We'll see you next Wednesday.
Wonderful.
All right.
Thank you.
Tina?